I'm Benita Altier, founder and owner of Pawsitive Dental Education, and I am here today with Olivier Morin. I am a vet tech specialist in dentistry, and I'm really passionate about dentistry. If anybody's met me, I definitely can talk your ear off about dentistry. And I like to partner with companies and products that I feel also are extremely passionate about dentistry and have really amazing products that I'd like to share with my clients, the professional veterinarians and technicians and receptionists. So today we're going to talk about a special thing with One TDC regarding how to present this to clients. Sometimes I know we get really busy in hospitals. It's hard to take the time to have those dental conversations. Sometimes they're not there for dentistry and we think, oh, well, we don't have time today. We're not going to talk to them about it. But I feel like every opportunity is an opportunity missed if we don't take it. So Olivier, you've come up with a really amazing way to incorporate from the beginning of an appointment to the end of the appointment, bringing awareness to our pet parents regarding their pet's dental health and ways that are visual, impactful, and can really call the client to action to make sure that they are going to follow recommendations regarding preventative dental care and dental care when things have already gotten out of hand and we're going to have to go in and do treatment. So can you tell us more about what you have for us?
Thank you, Benita, for having me. And you're right. I know your passion on dentistry. We've known each other for a very long time, and we share that passion. And what's interesting is, while a lot of people know about our One TDC product for periodontal health and joint health, actually, we wanted to facilitate that discussion with the pet owner in a way that they would be engaged versus feeling like you're trying to sell them something. And that's how the dental report card came about. So the whole idea, again, is how many technicians, how many veterinarians get jaded that the discussion never goes anywhere, the animal is in pain, and you can't seem to get through the mind of that patient owners that they need to do something about it. So that's this dental, we call it the One TDC dental report card. And I'm going to show you this. So the dental report card, the very front of it, and there's a secret to how to use this. The first part of the secret is who gives this to the pet owner. It's literally the front desk. They will say, today, Dr. Smith is going to take care of the rabies shot that you came in for, but we're also going to get a free oral health exam. That's all they have to say. That's all the time they have to say. And then they will give the dental report card to the pet owner. So what do they see? And let me tell you how this was created. We work with veterinary dentists, we work with veterinary technicians to really put this together. And our audience is actually a 9-year-old person. No disrespect to any pet owner, but we wanted to keep this super simple. Don't use terminologies that we use like periodontal, stage 1, 2, 3, 4. They don't know what that means. So we wanted to communicate it in the way that was simple for them to get, but more importantly, engaging them to do something about the issues that's in the pet's mouth. So as you can see, actually, in the front of the panel, it shows oral disease is painful. And it is. We know that, number one, that's one of the biggest problems. Pet owners don't realize that it is major discomfort in the pet's mouth. So what happens next? Well, before they go in the exam room, if the receptionist, he or she handed that to the pet owner, they're going to look at it and they're going to look inside. So here's a strategy on the inside. We have a panel that will do the scoring, and we both know very well that a lot of those patients have pain in their mouths. And that is what we're actually looking for, to get a form of diagnosis that is going to be able to tell us that. So we know that 80% of cats and dogs by the age of 3 years old have some form of periodontal health issues. That's a given. We know that. It's probably higher than this. This is an old statistic, but it's a very, very high ratio. So what's our goal here? Well, the dental report card starts with simple colors. We know that green is good, yellow not so good, and then red is going to need some urgent attention. So inside of it, we then did colors and then pictures. So using a dog here as a demo, we have first in the green, a very good looking mouth. Well, very few patients are going to look like this, but the pet owner is looking at this and wondering, does my dog look like this? Or you start going up and you start seeing more of bad breath. Well, a lot of pet owners can relate to the fact that their animals have bad breath. That's not normal. We're stressing that point here that it requires a vet's attention, and it can be painful. Unfortunately, most of the patients that come through a clinic are more into the red zone or in between the red and the orange zone. So what do we do? And how, now that they're looking at this, they come into the exam room and they give this to the technician or the veterinarian and say, oh, they told me I'm going to get a free oral health exam. Great. Well, then the pet owner is waiting for you to do something with this card. So what you do is you grab the card, and in the back of it, you have a gauze. With that gauze, this is the magic. You're going to very firmly apply the gauze on the upper gums 180 of that patient. Well, guess what? That beautiful white gauze is going to look like by the time you applied it on the gums. What are you going to see?
Probably going to see some brown, maybe even red, the colors you see on your brochure here.
You're going to see red. You're going to see blood. Now, the key thing in that moment is to educate the pet owner that, oh, it looks like we might have an infection. So you have to say. The next thing, and it's very true, you probably have a foreign object in the mouth that's causing that immune response, causing all the inflammatory cascade taking place where it's bleeding. So it's serious. Now, in our world, we would be like, well, that's probably a stage 2 periodontal disease at least, but that means nothing to a pet owner. But saying that there's blood, seeing the blood visually, and also saying that it looks like there's an infection, that registers in that pet owner's mind. Now, the first thing that you're going to do is you're going to then mark the place where it says inflammation, where it's in the red. Then you take a new gauze, you flip it around, and then this time you apply deeply on 180 on the teeth. And this time, to your point, Benita, you're going to see some brownish part. You're going to see the tartar and the plaque. Now, I'm going to mark this in my scorecard and say, oh, it looks like there's definitely some infection in the mouth. And then you're going to mark the fact that it is painful. You hit that mark as pain. Now, I'm going to say something to you that sounds silly, but I think it's very significant. I would even ask the patient owner, I said, is your dog still eating? And why am I saying that? Because we both know that periodontal health issues in the extreme cases will lead to the point where the animal is not eating. Now, thank goodness, that patient most likely is still eating as you're doing this, but you're also planting the seed to the pet owner that it is significant, it is serious. And you say, good, I'm glad the pet is still eating. We want to keep it that way. So in our office, we take those types of infections very seriously. So here's what we need to do. Then you go into the fact that we're going to have a prevention, a product that's very effective, promoting healthy inflammatory responses. And then you tell them about 1TDC. You have a dental kit if you're getting those. And then as you continue and you educate very high level what 1TDC will be doing, and there's videos to teach them how to use it and so forth. But then you go into, you really should be brushing. Now, we both know most people don't. Then you go into other things that needs to be done. Well, we'll do the 1TDC at first, and we'll do a recheck maybe in a couple of weeks. Or if it's very severe, you need to schedule a procedure. Now, what's important to note is a lot of veterinarians or veterinary technicians often talk about dentistry, identifying that there's an issue, there's a stage 2, stage 3 periodontal disease, and gives the solution that you really need to do a dental cleaning. The brain of the patient owner is usually, when they hear that, is, I don't know what periodontal is. It doesn't look right. My dog's breath smells. Who cares? And but how much is the dental cleaning? And what we're trying to do is not focus on how much it costs, but focus on how bad the problem is or can become. So by using the dental report card, by seeing the blood on the gauze, by showing the yuckiness from the tartar and plaque, by telling the fact that there's an infection, by telling the fact that your animal is in pain, that brings the pet owner into a more likelihood of wanting to do something about it. And very simply put, if I go to my regular doctor and identify that I have an ear infection, I'm not going to say thank you and walk away. I'm expecting my doctor to provide something as a solution to take care of the discomfort in my ear. Hopefully not a surgery, but any form of treatment. There's no difference here. Once they hear pain and you've identified that there's an issue that can be taken care of, they're more likely then to listen to you for a dental cleaning and, of course, walking away with 1TDC.
Absolutely. We like to use 4-letter words to call the client to action, like pain and need. So I think it's so important that they understand this didn't just happen overnight, but they're here now and we can help them. And I always tell the client, one thing is they're really bringing up cost. There's a cost to their wallet. I totally understand that. Anything we do in life, there's usually some cost to it. But I would like to say, what's the cost to your pet if we don't do something, right?
Agreed.
And the unfortunate situation with dogs and cats trying to just live their best lives and eat their breakfast, eat their dinner, is the pain has to get really severe before it would actually cause them to not eat. In fact, one veterinarian said to me once, we were doing a little role play trying to figure out how to communicate properly with clients. He said, your dog is going to eat till the pain gets so bad he'd rather die than eat. And I don't disagree with that because my experience is animals will eat to all sorts of pain until it gets to be excruciating to the place that can't think of anything else. And we just don't ever want them to get to that place, right? So this kind of idea, bringing visuals to it that people can definitely relate to and understand, and interacting with the client and the pet because we're all on the same team here. I always try to say, you're all on the same team, your pet, us, you all have the same goals. And how are we going to work together to make this happen? And you kind of creating that co-diagnosis where the client, the pet parent can see what we see as we're wiping the gauze on the gums or the teeth themselves. They see what we see on the gauze. They see maybe even if the pet doesn't want us to do that. And I would definitely say if we can't do this kind of thing safely, not to do it, because we certainly don't want anyone to get bitten or anything because something is painful in there. But just I've definitely used this visual cue of white gauze and blood on the gauze to say this is really indicating that the gums don't bleed for no reason, and we have potential for active what's called periodontitis, which again is big words, but whatever you can do to show them this isn't normal and something needs to be done about it. And these are our solutions and recommendations. It's a home care game too. What do we do at home to make sure that what we do in the vet hospital is more impactful, and together we're working as a team.
Exactly. And I think it's important to remember that most pet parents generally want to do the right thing. You're just bringing that discussion for them to be aware of what is the right thing to do, is to
Exactly.
manage what's in that mouth in the way that's non-threatening, doesn't make feel bad, but at the same time, if you really truly love that pet, you cannot let that continue as it's going. So
Absolutely. And if for some reason, even though we try to elevate the value of the procedures that we recommend and the product, one TDC, and really get them on board to our plan, sometimes they thought they were just coming in for, like you said, a rabies vaccine. They're not prepared for this, but we can send that report card home with them and say, you put this up on your fridge and think about it, because this is something we don't want you to forget. And we're going to give you a call in a couple days to remind you about our findings today and just give you some time to think about this, because we don't want to let it go. Your pet's that important to us.
but at a minimum, what we teach clinics is once you've identified the issues, you very often they need the proper dental cleaning. That's
Absolutely.
big on that. But send them home at least with one TDC so that there's something that can alleviate some of that discomfort. Pending, and look, and there's also a cost factor. Not everyone is able to afford, so we're sensitive to that. Do something at least to help with that. And when you're able to, then do the complete procedure.
Absolutely. I love that you have the QR codes on there for the videos, because what's the best product, what's the best exercise, the one you will do, right? So
Right.
it really having resources for them, which I thought was so amazing of your company to put this together, because as vet professionals being so busy and having to talk to clients about so many things, I really appreciated that you guys put the effort into making this seamless for us and really something that should be a part of what we're doing already, but really brings home the message that y'all are working together as a team, and that one TDC is a product that can be used without hesitation throughout the life of the pet, and can really make a big difference with everything that we want to do. So it's kind of that multimodal approach to finding things that the pet owner will be able to do, and not something that they'd really struggle to try to implement at home. So I think it's great.
And the beauty of this particular product is it's very effective when you implement it with the front desk, and we don't charge for those. So I think
Cool.
For example, some of your audience that already get the one TDC from your website, PawsitiveDental.com, whenever you place an order, you automatically will get those for free. So
Excellent.
you just contact us and let us know how many you need, and we'll provide them. If they
Okay.
haven't set up an account yet, they should do that. They could do that through distributions and so forth. But we like them coming through you because they have direct access to brochures and the dental report cards. Sometimes it's a little tougher with distribution. They can contact us also, and it's real easy. It's contact us at works with an S, sowell.com. And you just say, hey, I saw the show with Benita. I'd like to get some more dental report cards. We'll make sure you get access to that. You will
Excellent.
do more dentistry work, and you will be able to address more painful mouths with this particular dental report card.
Yeah, and a lot of practices are really trying to grow the dentistry portion of their practices and figuring out ways to make sure that there aren't patients that are clipping through the cracks every year and not really getting their oral health assessments properly done, especially those patients that are just coming in for vaccines and the people think they don't really need anything else. We all know that the important thing really is those exams and really incorporating a meaningful way of doing the oral exam into the process, I think is really helpful. So thank you so much.
Our pleasure. No mouths left behind. That's our goal.
No mouse left behind, definitely. And even if pets don't have any teeth at all, let's say some things have happened in their life and us vet people have had to extract all their teeth. This has a joint benefit, right? So
Yes.
even patients that potentially have had a lot of inflammation and a lot of prevention in their lives, this product could fit them as well as they get older, especially. So
No, there's no doubt. It's good periodontally, but even if you have no teeth, you can still have periodontal discomfort. So
sure, sure, absolutely. So, well, thank you, Olivia. I really appreciate your time today. And I know a lot of my customers will be interested in going to my website, checking out the products, going to your website through there. And there's a discount code. So we have a special code for you if you've watched this today and really want to get those dental report cards because I feel like that's really where it's at to get patients taken care of. So thank you.
thanks for your time and thanks for having me.
You're welcome. Thank you.